Today is Wednesday, the 10th of February 2021. This is a video for Health One users about the upcoming COVID vaccination schema we have in Health One. This will be available in the new version of Health One, version 8.8.02766. So I'm going to open a patient file, Mr. COVID test. I'm going to do a new transaction on him, a vaccine transaction. And in this version of Health One, we have a new little icon here for inserting COVID vaccine. This will be pre-populated by the 3 common COVID vaccines, and we can configure this if we wish. Normally the nurse, when she gets the vaccine, will fill in the batch number as she normally does and the expiry date. So let's give this patient the Pfizer vaccine. And we get the COVID form up. Now this is auto-populated from the patient file. The PPS number, which is part of the patient details here, is essential. You will not get paid unless you have a PPS number for the patient. If you don't have a PPS number, you will still be able to submit, but payment will not be done automatically electronically. You also have to have either an email or a mobile phone for the patient. If you have neither of these, which is not that uncommon in over 85s, then you will have the option of saying unknown here, and Health One will put in some zeros and send that off. The county is taken from the address in the patient's file. If it's not there, you just choose your county here, and Health One will save it into the patient file. This is the GP who's going to be paid. So the claiming GP will be entered here. Normally it'll be the same GP as is logged on down the bottom right here, logged on. So if the nurse is doing it, there will be nothing here. It will be empty, and she'll have to choose the claiming GP. So in this case, you choose this GP. His MCN and GMS number will come in automatically then from the user DB. It is absolutely essential that you get the GMS number and the MCM correct for the correct doctor, or you won't be paid. We have additional factors, which is now pre-populated with age-related eligibility, which is the case for all of our patients at the moment, as opposed to key workers or certain medical conditions. Here we have the patient eligibility, which you can ask the patient. Have you had anaphylaxis? Have you a bleeding disorder or anticoagulants? Have you had COVID in the last 14 days? Have you had another vaccine in the last 14 days? Are you less than 14 or more than 3 weeks pregnant? You can print this questions and answers for pregnant and breastfeeding women if you wish from here. You also have another tab here, the print tab, where you can print the patient consent. If you wish, normally these aren't necessary to print these, but they'll be populated there, and you can give that to the patient if you so wish. Patient vaccination passport is possible, and the patient information leaflet, which is the HSE patient information leaflet. All of these are possible to print. So if you go back to the patient consent, and we have here, he's given consent. And we can carry on now. So now we go to the vaccine tab here. And again, the patient details are the same as they were earlier. The vaccinator details are the important thing here. Normally, if it's the nurse that will be vaccinating, you'll pick the nurse. The nurse will automatically come up if she's logged in down here in the bottom right. If she's not logged in, if there's somebody else, then this will be blank and you'll have to choose the vaccinator. The nurse's job title will come in, and the Nursing and Midwifery Board of Ireland number will be entered here if it's entered in the user DB. So here is the COVID vaccination details. You've already done them. The batch number, the name of the vaccine, the manufacturer, the injection site here. You just click on your arm, the expiry date, and this is the first injection. You can enter comments here. At the moment, we're recommending that if you have to put in the batch number of the diluent, you put it in here. And when you're finished that, you're ready to submit. So you just submit this, and Health One will submit it to the PCRS for you. The message is successfully sent both the reimbursement and the clinical. So the clinical message has gone off and the claim, the STC claim has gone off. There's nothing else to be done as regards claiming. So as you can see, this is extremely quick and should take no time at all in Health One. If you want to go back into it and have a look at it, you can double click on the vaccine and you can go back there and have a look. You see here it's already submitted, so you don't submit it again. We've also added an invoice here so that you can track the payments via the billing module. So in this version, we also have, in order to analyze the population, we have a COVID vaccination dashboard, which is basically the same as the CDM dashboard. This will be filled with the name of the patient, etc., the vaccinator, the vaccine, and whether it is the first shot, the second shot, etc. So we will be able to filter this by all of these things up here: doctor in charge, patient age, give me a list of my 70 to 80s who have been vaccinated or not, etc. And when the claim comes back via the same method as the CDM, we will be able to manage this dashboard fairly easily. So I'll get out of the dashboard now, and I'm now going to do another patient in order to go through it slightly more slowly. In this occasion, I'm going to open Barry McCarthy and see what happens here. In this case, Health One has triggered an alert saying the PPS number for Barry is missing, and do you want to update the PPS number? This function is taken from the PCRS parser, and I'll briefly show you that now. So I'm going to update Barry's PPS number here, and if you look at his file here, you will see that his his PPS number has been entered in here automatically by Health One. Health One gets this number from the PCRS parser, Tools, GMS Duplicate Manager, PCRS parser. There is a separate video on the details of using this, where you download your list from the PCRS every month or once every 6 months or whatever you like, and then you open this file in Health One and you analyze it, and you get a list of patients here who are matching, etc. The matching patients here actually contain the patient's PPS number. So if the patient's PPS number is missing, as we had in this case when we opened the file, Health One will look in here at these lists and see if the PPS number is available. If it is, it'll enter it. If, however, you have never downloaded anything from the PCRS parser, these fields will be empty and there will be nothing there, so you won't get any alert. So I'm going to do a new consultation on Barry called Vaccine, and I'm going to bring up the thing again. I'm going to give him the Pfizer vaccine again, and again we have the PPS numbers picked up. The card number is also there, but this is irrelevant. You do not need the card number even on the over 70s. It's the PPS number that matters. His mobile number is taken up as we discussed in the previous one. So I'm going to now fill in these automatically. Go next. Invalid PPS number. So the PPS number is invalid. It's not a good PPS number. So we have to put in a proper PPS number. So now I have a good PPS number in there, and it will allow it. So this vaccinator, again, maybe the nurse or the doctor. We'll give it in the left arm. We have all this done, and we will in this case just save it rather than submitting it. And again, we have this done. Like all these things, we can view it in the analysis and the COVID vaccination dashboard. And that's the end of this recording, where we discussed the COVID vaccination implementation in the patient file. We have other things in this version for finding your relevant patient lists over 80, over 85, over 75 and over 70, and these are the subject of another video. That's the end of this recording. Thank you.